Morning and welcome to Global Healthcast, brought to you by Global Health Press. In this broadcast series, once a week, we bring to you news and views about infectious diseases, vaccines, and vaccination. Today is February 7th, 2023. I am Joe Schmitt, and with me is Dr. Melvin Sanicas. Good morning, Melvin.
Good morning, Professor Schmitt. Good morning, good afternoon, everyone, depending on when you're watching the Global Healthcast.
The topics we cover today are, as always, the COVID-19 update, the variants that are circulating, COVID in China, flu decline in the US and globally, effectiveness of the monkeypox vaccine, one dose only seems to be working, effectiveness of a 4-component meningococcal B vaccine, and finally, the Kruger-Dunning effect. And Melvin, I'm very interested to see how things are moving on with COVID.
Yes, so for those who have been watching us, you know the drill. We do this every week. We start with a WHO COVID situation report, and we talk about the global epidemiology. So nearly 20 million new cases and over 114,000 deaths were reported in the last 28 days. And this is actually a decrease of 78% and an increase in 65% respectively. So the cases went down and number of deaths went up compared to the previous week. And if you look at the epi curve, you will see here that there's a spike in the week of 5th of December and also a spike in the week of the 2nd of January 2023. And this is mainly because all those cases and deaths in China were reported late, and they are shown here in this graph.
Okay. So this is due to a delayed reporting, data coming in at a later point, but then they correct the previous periods.
Yes, that is right. But then we will have this blip here because this was reported on that week, and that's how they put it in the graph. It's reported, it's shown here when it's reported.
Okay, interesting. And how does it look globally?
Yes, this is looking at the number of cases for each of the countries. For the previous week, at the country level, the highest numbers of new weekly cases were reported in Japan, the United States, the Republic of Korea, China, and Brazil. And for the current reporting week, the same countries are the top 5, but this time China came on top with Japan and US only coming 2nd and 3rd.
And certainly case numbers probably are somehow related to deaths. And I guess this is what you show in the slides, in the slide here.
Yeah, partly. And the reason why I say that is because in terms of the cases, we know that there is reduction in testing for practically everywhere, right? People are not testing as much anymore. And reinfections are a bit tricky because some countries are not counting them. Some countries are counting them. And then we know that there is delay in reporting, as we've seen in China. So I would really interpret that with caution, although deaths is a different story altogether. In terms of death, for the previous week, the highest number of new weekly deaths were reported from the United States, Japan, Brazil, China, and Spain. Remember, Spain was not in the top 5 in the number of cases last week, but they were in the top 5 in the number of deaths. But for the current reporting week, China again came on top with the US, Japan, United Kingdom, and Brazil as the 2nd, 3rd, 4th, 5th in terms of death. And United Kingdom is not part of the top 5 in terms of cases, but in terms of death, it's actually number 4. So there is some slight incongruence there in terms of cases and deaths.
Okay. Yeah. Actually, last night I found a very interesting article in the New York Times And as a background, you may remember that they had a no COVID policy for a very long period of time, actually until December 8. And what the people from the New York Times did is they looked in obituaries from scientific institutions. And in October 22, they had like 4 people, and you see 92 years old, 90 years old, 99 years old, 90 years old. So if you're a great scientist in China, you die at an old age. I guess that is a nice and interesting learning. But look what happened. This is December, and December 8, they abandoned their COVID restrictions. And then all of a sudden, the number of obituaries starts to increase. And look what happens in January. And many of these people died. And look, they were all in their 90s, 95, 90, 91, 96, 96, 97. This was a young one, 57, an outlier. But then look here, these people tend to be a little bit younger. I mean, there are some 80, many 80 years old, still some 90 plus, 98, 77 people is also here. So they tend to become, they're still old, right, 80 plus, but they tend to be a little bit younger. Now, you may say, this is influenza, this happens every year, why do you worry? Look what the journalists did. They looked at the obituaries over time, 2019 to 2022, and this is the number of obituaries in these prestigious Peking University Health Science Center. And all of a sudden, in December, this number, the number of obituaries, I guess, quadrupled or at least tripled. And then look what happened in the obituaries with the Harbin Institute of Technology, same observation. And here obituaries by 2 state-backed institutions, I guess at least doubling or tripling of numbers. So this may be due to COVID. We don't know what these people died from, but I think it is very interesting. And the one thing you can say is it is associated with the sudden opening of the COVID restrictions. Melvin, what is your views about this way of looking at epidemiological curves?
Yeah, I think it's pretty clear that 2022 was actually really different as compared to the previous years, even with COVID. And from a personal standpoint, I have several friends and ex-colleagues who are in China, live in China. And then, of course, we've been chatting about COVID since 2020, right? But all of them who are living in China in the past month, in December 2022, all of them told me that they know a friend or a colleague who died, but that never happened in 2021 and 2020. So I guess it's just showing us the effect of this sudden opening of China, of the removal of the zero COVID policy. And it tells us about the effect of COVID in a population that had been vaccinated only with inactivated vaccines, largely.
Yeah. So many messages to be read here. And I think this is a very innovative way to look at a situation and to judge about what is going on in the country. And you don't need a spy balloon to get that data. You just check the newspapers, right?
Mm-hmm.
Melvin, this is all about deaths, and I'm certainly wondering what the variants are that are circulating, and you compiled this very nicely here.
So yes, as we have mentioned last week, we mentioned about the variants, right? That compared to their parent lineages, these newer Omicron subvariants, right? We talk about BQ.1, BQ1.1, BF7, BA2.75.2. The sera from vaccinated and SARS-CoV-2 infected participants were collected, and they were actually not able to fully neutralize these new subvariants. So that is worrying, right? But again, these are laboratory studies. What we want to show in this slide is that these variants, they're circulating differently in the world. And this might be due to a variety of factors, including previous circulating variants in the country, vaccination coverage, even the type of vaccines used, booster coverage or lack of, and the implemented public health and social measures. So I guess if you look at all these difference of variants, you will notice that in some parts of the world, like Africa, America, Europe, the main subvariant is the BQ 1.1. But in, for example, the Eastern Mediterranean and Southeast Asia, it's the XBB.1. And if you talk about Western Pacific, which includes China, you have this BA.5.2 and BF.7. Although I want to highlight the fact that in terms of the number of sequences being done in these regions, you will see for Africa, they only had 332 sequences. For the Americas, 40,000 sequences. Eastern Mediterranean is 85 sequences. Europe, 40,000 sequences. Southeast Asia, 389 sequences. And Western Pacific, over 15,000 sequences.
So this has to do with money for healthcare. I remember from our vaccination website that Germany spends 5,000 euros a year per capita for healthcare. And in some African countries, it is $50 and less. And if you spend 100 times more, then you can do these sequences, right? If you don't have the money, then you don't sequence. Melvin, is there any effort to make sure that these sequences come from various sources so that they're not all linked to one outbreak or one city or one? Is this spread information or is this strictly local information?
So for the regions that are doing a lot of sequences, like America, Europe, and Western Pacific, these are actually from really different countries and different locations. But for the ones that are not doing a lot, you are right. They are coming from the same places, the same countries that are actually considered more affluent or more advanced in terms of science and resources.
So I would expect the African sequences largely come from South Africa.
They are from South Africa. They are from Senegal. They're from Morocco. The countries, yeah.
Interesting, yeah. Very nice. And we leave now COVID and we move to influenza. And I like this picture very much because it is a wonderful epic curve. And maybe you can explain this to us.
So this is talking about seasonal influenza in the US alone, although we know that it is what's happening in the rest of the world as well, that seasonal influenza activity is declining. And in the US, hospitalizations for flu and flu activity at long-term care facilities, which is important because that's where most of the deaths are happening, even pre-COVID, right? The numbers of hospitalizations for flu and flu activity in these long-term care facilities are also declining. You will see here that they have subtype influenza, and you will see the colors, right? And most of them are H1N1, H3N2, or just A that was not subtype. And you will not see the B Victoria or B Yamagata lineages. We don't know why, but that certainly happens. But the good thing about this is really the typical epicurve of flu in pre-COVID times. You will see it goes up in November, December, January, it starts to go down and then disappears. You will also see here, I've written here the estimates of the numbers of illnesses, hospitalizations, and deaths from flu. For the past 2 years, where we had the lockdowns, the masking, and all that, there was really very, very little in terms of illness, hospitalizations, and deaths, practically even zero, actually. So the message here is that flu is back from hibernation. And I guess we will be seeing this in the next few, in the next several continuing years, because we are not staying at home anymore.
Yeah. Yeah, COVID is over. COVID took care of influenza, but now influenza is back and co-circulating with RSV and influenza and all the other pathogens. Very interesting. I like the curve. It is really normal distributed. So quite interesting. Yeah. And actually, I'm devastated by the number of cases and 17,000 deaths. And I guess you have on the bottom here the reminder that everybody aged 6 months and older should get the annual flu vaccine. And I think this is a very good idea. And make your decision at least in autumn this year. Melvin, monkeypox is the other pandemic we had last year, and maybe this is good news, and maybe you can tell us about the good news here on the monkeypox vaccine.
Yes, we have not really discussed monkeypox or the MPOX. We should say MPOX now, right? Because we're not supposed to say monkeypox now. We have not discussed this for a while, but remember in the middle of last year, there were lots of doom and gloom reporting about monkeypox being the next COVID, right? Remember, people were saying this is going to be the next pandemic, blah, blah, blah. And again, just to remind people that that did not happen. But what I'm trying to say here is that there is this vaccine called Jynneos, and this has been approved by the US FDA to be given as 2 doses 4 weeks apart. But because of the low vaccine supplies last year, many countries have been giving MPOX patients a single subcutaneous dose. So it's under the skin into the fat layer, followed by a smaller intradermal dose just underneath the outer epidermal layer of the skin. And this study shows us that the estimated vaccine effectiveness of just 1 subcutaneous dose of the Jynneos MPOX vaccine among men in Israel was 86%. And this, for me, is quite high, actually. And the authors were saying that completing the second vaccine dose, as per the label, may actually improve effectiveness and provide longer lasting protection.
Yeah, that is what you expect, right? The first dose gives you immediate somewhat protection, but the second dose is the one that gives you long-term protection. And the second general rule is that the later you give the second dose, the longer protection may last. We don't know that, but that is what I would expect if you delay the second dose. You have some protection initially, and this is actually quite impressive, 86% with 1 dose. And then the second dose may give you long-term protection. Will they give the second dose? Is this in the planning? I guess. And then they come up with more data later on, right?
Yeah, this was just published recently, and I guess they will be giving a second dose. But related to what you said about this being expected to sort of increase the efficacy or immunogenicity of vaccines if given in a longer interval, we've seen this as well in other vaccines, including the AstraZeneca COVID vaccine, where a study showed that if you compared 0 to 4 weeks versus 5 to 8 weeks, you will see that the 5 to 8 weeks interval actually showed significantly higher efficacy. And so I guess that's an immuno thing.
Yeah. Very interesting. Thanks for the good news. My next topic is meningococcal disease, and invasive meningococcal disease is severe disease with at least 5% case fatality rate. Usually it is 10+%. And those who survive very often have deficits, like they need amputation of fingers, arms, or toes, and whole legs. So it's a severe disease, and it is quite rare. And what you see here is the 2016 incidence map from the European Centers for Disease Control. And you see England, the United Kingdom, and Ireland are still part of the European Union at the time. Switzerland is this great area here. They cannot be part of the reporting, which is totally ridiculous. Why don't they publish the data here, right? It's in the center of Europe. And Latvia has a somewhat higher incidence than the other countries. But look, this is all below 1 per 100,000, and the dark brown is more than 1 per 100,000. Meningococcal diseases are rare. There are 5 serotypes causing human disease. We have a good vaccine, polysaccharide conjugate vaccines, that are effective against serotypes ACWY, but there only recently has been 1 or 2 vaccines that were licensed against meningococcus B. And again, it's a rare disease. What is not shown here in the map is the danger with meningococci is that they occur very often in outbreaks. And there may be pandemic outbreaks associated with a Hutch or with one country, like there was a meningococcal B outbreak in New Zealand, and there was a specific vaccine produced for that outbreak. So the outbreak is really something that worries people, not only the incidence. Here you have the epidemic curve from the United States. This goes to 2019, and the reason is after 2020, with hands washing and masking and restrictions in meeting other people, disease incidences went down. Remember, this is a so-called kissing disease, one of them. And if there is no kissing, you don't transmit the disease anymore. So very low numbers, well below 1 per 100,000 in the United States as well.
I think, Professor, it's interesting just to mention that the masking and social distancing and all these things practically removed meningococcal disease and influenza, right?
And many other diseases, and the pneumococcus, and actually gonorrhea.
RSV,
because people, RSV, exactly. Many infections disappeared. There was one disease only, to the best of my knowledge, that increased, and that was tick-borne encephalitis. And the reason is unvaccinated people no longer went to nice and warm countries, but they stayed in Europe and went outdoors and didn't get their vaccine shot, right? Because they never went to the local areas for their vacation. They always went to the Mediterranean areas or to Southeast Asia. Now they went to these areas that are TBE endemic, and they came down with the disease. There was a huge increase of TBE.
Okay.
In any event, a good point you make. Many diseases disappeared during COVID, and now they return. And here for group MenB, just one example for an outbreak here, end of 2022, in a discotheque in Strasbourg in France, close to the border to Germany. That's where the European Parliament sits. They had an outbreak with a meningococcal B strain, and there were 4 cases, and they started vaccinating, and they started giving medication to prevent spread of the disease. Now, the big question is if the newly licensed meningococcal 4-component vaccine is working, and this is the data from Spain to show that there is high effectiveness. What you see here is a nationwide matched case control study for the 4-component meningococcal B vaccine in children up to 5 years of age, up to 60 months. And it was a matched case control study, 306 case patients and 1,224 controls. And then let's go to the effectiveness. Effectiveness of complete vaccination with at least 2 doses is 76%. Effectiveness of partial vaccination, 54%. Look, this is different from the monkeypox. This is why we were so impressed with the 86% in monkeypox. It certainly may have to do with the age of the vaccinees. This is children under 5. So 1 dose is not enough, and that is different, I guess, from monkeypox story. Effectiveness of at least 1 dose against MenB is 64%, and effectiveness against non-serogroup B is 82%. So the question then arises, do you need the ACWY polysaccharide conjugate vaccine if the meningococcal B vaccine already protects you against ACWY strains? Very interesting study. I guess more will follow. And by the way, this vaccine, it's another publication, this vaccine also protects to some degree against gonorrhea. So, there are different benefits. I showed this as a response to outbreaks and as a response to a severe disease that is quite rare. And I guess you have to make your own choice if you want to get vaccinated or not against meningococcus B. Melvin, any thoughts on this study?
Well, I think it's really interesting to see that it's actually really working, right? And even though we say that the numbers are a little less than the 86% for the Jynneos one-dose vaccine, um, the effect of a vaccine that's even just 54% effective is really great in terms of reducing hospitalization and all these negative effects of meningococcal disease.
Yeah. I guess looking at partial vaccination versus complete vaccination also shows you that there is a dose response effect. So the effectiveness seen is causal. There is causality, which you cannot assess usually in an effectiveness study. And by the way, an efficacy study with a meningococcal B vaccine is not feasible. If there is an incidence of 1 per 100,000, you need to double-blindly randomize a whole country like Switzerland or Germany to then find out if there is any efficacy, because case numbers are so low. And the licensing only occurred based on serology. There was good correlate of protection data, but again, it's really reassuring that the vaccine is working now. And again, this is data from Spain. Lastly, Melvin, I came across one study that is from 1999, and you may like it because you always worry about fake news and wrong news making it into the social media. And I found this study in the Journal of Personality and Social Psychology 1999 edition, and it is about unskilled and unaware of it. Difficulties in recognizing one's own incompetence leads to inflated self-assessment. And I think this is quite interesting. Basically, the background is that people tend to favorably think of their abilities. And this overestimation occurs particularly in people who are unskilled. And so these unskilled people have two disease burdens, if I may say that. Number one, due to their lack of skills, they come to erroneous conclusions and they make wrong choices, like not getting vaccinated. And number two, their inability, their lack of skills robs them of their ability to realize that their thinking is wrong and that their decisions are wrong. So these authors in 1999, they did 4 studies, and what they found is on tests of humor, grammar, and logic, people who really scored low in testing overestimated their abilities. So their test showed them an ability score of 12 in the 12th percentile, but their self-assessment was in the 62nd. And several analyses of these authors linked this miscalibration to deficits in the metacognitive skills or the capacity to distinguish accuracy from error. And paradoxically, improving the skills and thus increasing metacognitive competence help recognize people to realize their limitation abilities. And I think very interesting, people who are really among the top performers in tests, they underestimate their abilities somewhat, right? I mean, the delta is not too high here and as far as here, but I guess if you know more, you still think, oh, gee, I don't know it all, right? Anyway, Melvin, what is your point on this study?
Just 2 things. I think number one, it's really what we see on social media these days. You see that people who have no experience, no educational background, nothing about science, they seem to oversimplify things, and they just think that it's as easy as just Googling whatever information. And what happens basically is they just choose whatever article they see on the internet that would satisfy whatever their beliefs are. And secondly, we see this as well in people who really have studied a particular study, right, or a particular topic. It doesn't have to be science. It can be music. It can be engineering. It can be literature. The people who really have studied a particular subject, they really actually think that they don't know everything, that they need to study more. And so I guess there's some form of humility there for people who have the real knowledge.
Yeah. And there is more insight. I mean, this is one explanation why there are, in Germany, we call them Querdenker, why there are these people doing funny things that are off any science and knowledge. There may be other explanations, and maybe we cover those at a later series.
Well, I think it's just really these days, right? Because of social media, there are people who really are not knowledgeable, and they're spreading all this misinformation. But there are people who are actually quite knowledgeable, but they're sharing misinformation because they just want clicks, they just want shares, they just want to be popular, because there is an incentive. In, for example, in YouTube, the more views you have, the more clicks you have, you can actually monetize it. So they earn more money when they share all these very controversial information.
Yeah. Maybe it would be worth to cover the whole topic at a later point, to look more into wrong information in the internet. Melvin, this was our Global Health Cast today. We covered the COVID update with the new data from China with an increase in numbers and in deaths. We talked about the variants that are circulating based on different type of testing in different areas of the world. You saw that there is an increase of deaths in China among scientists, and that was a study published in the New York Times from looking at obituaries. We spoke about flu decline in the United States and globally. You saw the nice epidemic curve going up and down again. We talked about the effectiveness of one dose of Jynneos monkeypox vaccine at 86% only. Effectiveness of the 4-component meningococcal B vaccine, actually, as studies could not be done to show efficacy. This effectiveness data is very reassuring. And finally, we spoke about the Kruger-Dunning effect. Unskilled and unaware results in self-overestimation, and this certainly may be a cause of fake news. Melvin, what is the funny of the week?
I chose this one because if you remember back in December 2020, when the vaccines were new, anti-vax people all over the world were saying sorts of funny things and absurd things about vaccination. And one of them is certainly they're saying that if you get the vaccine, you will turn into a zombie after 2 days, and then nothing happened. They say after 2 weeks, and then nothing happened. They said after 2 years, and now they're saying after 2 decades, people will become zombies. So basically, it's just, we're just waiting to become zombies in 18 years.
Yeah. So this is the zombies who all got the vaccine, and this is the one person who survived and did not get the vaccine. Yeah. I think this is very funny, Melvin, and thank you very much for your insights today. And actually, by the way, I just got my 5th dose 2 days ago. You see, I'm doing well. I didn't have a fever. I had a little bit of a sore arm for half a day, and I'm very healthy. This was our Global Health Cast today on February 7th. Please like, share, and leave your comments below. Thanks for joining us today. I am Joe Schmitt.
And I'm Melvin Sanicas. Thank you, everyone. Stay safe. Get boosted. Get vaccinated if you haven't been vaccinated.